My name is Maya Harris. I have type 1 diabetes. I was diagnosed in the year of 2017 when I was 8, and I'm going to show you how I manage it today. When I was 8, I went into ketoacidosis. My levels were at a high range of 45.5, and I had to go to the hospital. Sucked because I missed my whole spring break and spent it in the hospital, but it really has changed my life. And some ways positive and in some ways negative. Well, I used to just be able to go eat whatever I want, and I wouldn't have to worry about carbs. I didn't even know what carbs were. And I remember when I was first in the ambulance, they said that she has been diagnosed with type 1 diabetes. I'm like, oh, that's okay, it can be cured, right? And I had no idea what it was, and it really has affected the way I think of food, the way I think of everything. And now at lunch, I have to go to the office, and I have to take my blood glucose levels and check them. In this kit, I have everything I need. So I have my glucometer, I have my poker, and I have my strips. So how it works is I'll take out a strip, and I will insert it into my glucometer. And then my poker, I will poke one of my fingers with it. Sometimes I have to poke again because it won't get blood out. And again. And again. This better have worked. Okay. Yay, got it. So I will check my levels and we'll see what they're at. I'm at 14.1, which is high, so I'm gonna need to give myself a correction. So how a correction works is, since my body doesn't produce insulin anymore, because diabetes is when your pancreas stops working. Well, not really stops working, stops producing insulin, I guess. I have to take insulin manually through a needle. So the pen looks like this, blue. I will take the lid off. I will give myself a needle. So this is what the needles look like. And then I will prime it. And then I will inject it. So, I'm going to inject it now. It was at 0. So, there we go. And then it will start working soon and bring my levels to a normal level. I don't know. I have to check my levels and take insulin. That's all. Really, that's all that's changed. I have to take it maybe 5 to 10 times a day. It's a real pain because I don't really like needles, and even if I went on the pump, it's still noticeable, and people still ask me what's that, and people still think of me that I'm not normal. So it's hard, I guess. They have to check my levels, which I don't like either. It can be a real pain sometimes because I get bad calluses on my fingers. And I don't like the way I feel when my levels are high or low. And I don't like how I have to miss out on things because I have diabetes. I don't like having to record it in a logbook. I don't like lots of things about it. I don't like that my parents are more overprotective of me. I don't like that I have to take visits to the hospital. I don't like that I have to go to the office at lunch and call my parents. I don't like that when there's birthday treats or something, I can't eat it. I don't like when there's food or something and I have to wait and I have to go somewhere else to take insulin or something like that. The one thing I do like is getting to eat candy when I'm low. I guess that's it.